Hi, I'm Dr. Cooley, and thanks for joining me on this webinar. I'm going to be discussing why can't I sleep, or why do people have a hard time sleeping. When it comes to sleep, there's a lot of different causes for it, but the most all-encompassing term as to why people can't fall asleep is they have too much stress going on in their life. Okay, that's probably the biggest driver of all sleep dysfunction. Stress can come from a variety of sources. It can come from pain and inflammation. It can come from things like infections, allergies, things such as emotional stress, your diet is a huge stressor to your system. Overtraining, working out too hard can be a big reason why you have a hard time falling asleep. And the last thing we're going to talk about is blood sugar and how that affects your sleep habits. When it comes to improving our sleep, one of the first things we have to discuss is hormones, okay? So how our hormones affect our sleep. And the two main hormones that are going to have a pretty big impact on how we sleep are going to be cortisol and melatonin. So our cortisol levels and our melatonin levels, they have this normal circadian rhythm. They have this normal ebb and flow throughout the day. Cortisol levels, we want those highest in the morning between 7 and 9 a.m. and then we want those at their lowest between 11 and midnight. And melatonin, we want that almost undetectable throughout the day, and we want that at its highest levels at night, okay? Abnormalities in how our cortisol levels fluctuate throughout the day can be a big reason why people have a hard time falling asleep at night. And cortisol function is going to be determined from our adrenal glands, and our adrenal glands are going to be driven from stress, okay? Our adrenal glands are these small walnut-sized organs that sit on top of our kidneys right here. They have a lot of important jobs in our body, but one of the biggest things that we need them for is stabilizing blood sugar. That's a big thing. They're basically huge at allowing our body to adapt to stress. So whether it's when people talk about that fight or flight mechanism, when our body is stressed, it basically brings our adrenal glands into action, okay? And we like to think of it in terms of, like, say we're getting chased from a saber-toothed tiger in prehistoric times. Our adrenal glands would essentially get called into action to give our body the tools it needs to get away from that threat. All right. Unfortunately, fortunately, we're not running away from saber-toothed tigers all the time, but our body is basically in this constant state of stress just by the lifestyle that we have created for ourselves in 2016 now. The adrenal function, what your adrenals will produce, the main hormones that it produces are cortisol, DHEA, aldosterone, and then it will also produce norepinephrine or noradrenaline and epinephrine or adrenaline. It also will produce smaller amounts of estrogen, progesterone, and testosterone. So it will have a huge impact on all our hormones, and it affects every cell in our body, is how well our adrenal glands can respond to stress. When we're looking at adrenal dysfunction, you can look at the adrenals. They could either have a pathology or they could have dysfunction. So in typical Western medicine, they don't really recognize the adrenals having a problem until it's gotten to the point of like a pathological disease, something like Cushing's syndrome or Addison's disease, which are actually pretty rare. But adrenal dysfunction is something that's super common, and pretty much anybody that's going into a doctor's office seeking treatment for something has some form of adrenal dysfunction. And the main reason for that is if our adrenals could handle the stresses that our body was placed upon it, we wouldn't have reached a point where we're seeking treatment. However, I like to say that a lot of people, when it comes Western medicine doctors, they often don't look at the adrenals enough, but when it comes to alternative providers, they often blame the adrenals for everything that's gone wrong on the person. And like I was saying before, pretty much everybody has some form of adrenal issue, but the biggest thing is you got to figure out, why are the adrenals being stressed? And if you can't figure that out, then treating the adrenals or giving something to support the adrenals is not going to have a really long-lasting impact. All right, so some of the examples of how our sleep can get impaired from our adrenal function are, a classic example is you feel tired, you lie down, but you cannot fall asleep, okay? That's a that can be a big sign that your cortisol levels are abnormally high at night when they should be lower than normal. Another big cause is you actually wake up to go to the bathroom at night. Even if you drink a big glass of water before you go to bed, you should actually be able to get through the entire night without having to go to the bathroom. There's a couple of reasons for this, but one big reason could be a vitamin B1 deficiency, or like an athlete that's overtraining. They can use that as an indicator that their training is too hard. Like they start going to the bathroom at night, or they start waking up to go to the bathroom at night more than they ever did before. And a couple of reasons for that is it has to do with how our aldosterone retains fluid in our body, and the aldosterone is a hormone produced from the adrenal glands. Tossing and turning at night can be a sign of adrenal dysfunction, and just waking up tired can also be another sign of adrenal dysfunction, because if we wake up in the morning and our cortisol levels are actually lower than they should be, which is another sign of an adrenal issue, then we're going to wake up tired. We're not going to wake up with energy. One big thing that I see overprescribed all the time, especially from natural health care providers, is melatonin. When a patient asks me if they should take melatonin for sleep issues, very rarely do I say that they should take it. And for the simple reason is you don't really ever want to take any hormone, because as soon as you start taking that hormone, you're going to inhibit your body's production of that hormone. This is not to say that people that are taking Synthroid or other hormones that they should stop taking these things right away. I would definitely recommend against that. But if someone is considering taking melatonin for a sleep issue, you got to be very careful with that. I definitely wouldn't go over 3 milligrams per day on that. And if you say you do take the melatonin and you see an improvement from taking it, don't take it over a week, and use that as an indicator to be like, all right, something is wrong. I need to figure out why my cortisol levels are so high. I need to work with someone. Like, why am I getting this response to the melatonin? It's all right. I realize that this has helped my sleep, but this isn't the solution to my problems. Okay. The only other times I would recommend using melatonin is when daylight savings time changes, or when you're changing time zones. That's when it can also be beneficial to somebody. A couple of big reasons why someone may have a melatonin issue is it could be an underlying gut disturbance. So we make melatonin in our body. It actually comes from serotonin, and serotonin production is reliant on a healthy gut. So someone that responds well to melatonin, you might need to think like, oh, I gotta, there's something wrong with my gut. That might be some alarm that goes off in your head. Equally important to sleeping through the night, equally important to having a balanced hormone system for sleeping through the night, is having balanced neurotransmitters. The key neurotransmitters for sleeping, the biggest one is really GABA. Okay, so GABA is a neurotransmitter. We call this, it's an inhibitory neurotransmitter in our brain. So what that does is it actually like calms down neurological activity that's occurring in the brain. So most drugs that are based on, most sleep drugs such as Ambien and Lunesta, what they are trying to do is they're trying to stimulate the body's receptors to GABA. So they're trying to like essentially improve the way our body responds to GABA. Okay. Other medications like Xanax, so like a real strong anti-anxiety medication, that's a GABA drug too. So one of the reasons why we can't sleep is we have this lack of GABA, because we have all these neurological signals going off in our brain that we just can't calm down. Okay. A big thing you will see in patients that can't sleep is they have a GABA deficiency, but it's really they have this excess of noradrenaline, either from too much caffeine intake or from too much stress in their system. So again, it's like somebody might respond to taking Ambien or Lunesta. So you need to think in your head like, all right, that means I responded well to something that stimulated GABA in my body. But you don't necessarily know if why you got that response was that you really needed to stimulate GABA, or maybe it's more you need to calm down some other signal, something like norepinephrine. You need to get those levels down, okay? Some natural ways to stimulate GABA in your body are herbs such as valerian root, passion flower, but we also need to have like good energy production in order for our body to make GABA, and we need to have adequate levels of B6, B1, magnesium, and zinc. When it comes to sleep issues, magnesium and B6 are probably two of the most common things that I have to give to patients in order to get them to sleep through the night. Other neurotransmitters can definitely affect sleep issues. Something like dopamine is usually linked to restless leg syndrome. So, or when it comes to restless leg syndrome, look at that as that can be a dopamine deficiency. Not always, but that can be a big reason for that. If you have too much dopamine in your system, that can actually cause someone to grind their teeth at night. Similarly, too much serotonin in your body can actually cause you to grind your teeth at night too. They've had studies where someone that's a teeth grinder suffers from what we call bruxism. The amount of pressure that they can exert on their mouth is like 7 times higher when they're taking a serotonin type drug than what they could do otherwise. So sometimes if you're on an antidepressant, that can be something that can cause you to bite down really hard or create a lot of damage to your teeth at night. So if you notice you're waking up and your jaw is really sore, you got to be careful taking those antidepressants. Another big thing that people wouldn't ever really think of when it comes to being able to sleep through the night is liver function. And this is something I see all the time in practice. When people are waking up between 1 and 3 a.m. at night, that's often due to a liver toxicity issue, or the liver is being stressed at that time. And this actually has to do with the acupuncture meridian system. The acupuncture meridian system, according to the acupuncture meridian system, our liver is most active between 1 and 3 a.m. And when this is occurring and we're dealing with a lot of toxic overload, our liver is going to become stressed, and that can actually be something that can wake us up at night. So a lot of times it's someone that wakes up between 1 and 3 and has a difficulty falling asleep in that window. Now when it comes to toxins, this can be a lot of different things. It can actually be hormones that your body is producing. Those have to get detoxified. So if you're stressed and you're pumping out a lot of cortisol and you're loading your liver that way, that's going to be a double whammy. That's going to make it really tough for you to sleep. A medication can be a huge liver stress to somebody. Too much caffeine. If you're a coffee drinker and you're having a hard time sleeping, you really have to be careful that that's not contributing to your inability to sleep. If you have a hard time sleeping, I wouldn't have any coffee after like first thing in the morning, and even then that might be too much. It depends on how sensitive you are to caffeine. Other common toxins are things like heavy metals, just our toxic environment that we get exposed to every day. Another sign that your liver might be stressed or your body might be toxic is just being fatigued all the time. A lot of times people are more, like to say, they're more toxic than actually tired. They feel tired and fatigued, but it's really just because of this toxic overload in their system. And it's all about these vicious cycles that people get trapped in. So if your body's pumping out too much cortisol and you can't detoxify that, then that's going to cause you to have excess cortisol around and to make it hard for you to fall asleep. At the same time, if you're loading your liver with too much cortisol, then you're not going to be able to detoxify these other chemicals, and that can create another vicious cycle. So if you're waking up between, again, continuing with that acupuncture clock and how that can affect our sleep, if you're waking up between 3 and 5 a.m., that could be something like a lung stress, like you're dealing with some allergies or inflammation. If you're waking up at 5 a.m. but you can't fall back asleep, a lot of times that's indicative of a large intestine issue, like some gut stress, some gut dysbiosis, or it could be a food allergy, something like that. Just general good sleep habits that we all need to incorporate into our regular routine is you want to try to go to sleep at a similar time every night. Like, it's better to go to sleep at like 10 p.m. and wake up at 6 a.m. than it is to go to bed at like 1 a.m. and wake up at 9 a.m. Now, granted, if your job, depending on what you have to do for your life, your body will adapt to whatever it needs to. But in general, as a general rule, you're gonna be better off going to bed at like 10 o'clock, waking up at 6, just because it's closer to like the daylight hours and stuff. Darkness is key for falling asleep. The darker, the better. Try to remove any artificial light in the room. Also, a big thing is also getting rid of all electronic devices. So making sure there's no like EMFs in the room. Some people are really EMF sensitive, and that's like the Wi-Fi signal in your house. Like if I would not have that in your bedroom, like keep that away from your bedroom and your kids' bedrooms and stuff. The wireless router and stuff like that. Don't watch any like really intense shows, like things that are gonna be really stimulating your body. Like I like to watch Homeland. That's something I don't really want to watch right before I go to bed, because that can really like wake me up before I go to sleep. When it comes to mattresses, a lot of times people overly blame their bed as to why they can't sleep, or they overly blame their bed as to why they wake up in pain. And I wish I had a good mattress I could recommend to everybody, but it really comes down to what works best for you. You just have to try them out. I would say it's rarely the bed that's the problem. You really need to look at more your lifestyle choices as to why you can't fall asleep, or as to why you wake up feeling really groggy and sore. So the keys to sleep health are really like try to identify what is stressing your body. And this can be really difficult to do, but that's essentially what you need to do. You need to try to figure out, why is my body pumping out this cortisol, or why is my body like can't calm down when it needs to. When it comes to the things you can just start doing on your own, check out my fundamentals of health on diet and nutrition and living the aerobic lifestyle. All those things are key for any condition that I would try to treat. And when it comes to stress, you gotta identify that you can control what you can control. You can't control, in some ways, you can't control your work, and you can't control other stressors, like some things that might happen like in your external environment. Okay, you can't control your neighbors to some extent, but you can control your diet. You can control how hard you work out. Okay, you can control what time you go to bed at night. You can plan activities so you're not so stressed, you're not so rushed all the time. And another big thing is actually making sure your finances are in order too. Like working with a professional to make sure you're budgeting, just because that's such a huge stressor to the system. When you're stressed out about it, like living paycheck to paycheck can be so stressful that it can be really beneficial to work with somebody that knows what they're doing as far as getting you on the path towards having stable finances. I always talk about stable blood sugar, but stable finances is probably equally important. And again, if you got any questions on how I go about treating someone with specific sleep issues, feel free to contact my office. Feel free to email me. I usually get back to you pretty quickly. And thanks for checking out this webinar.